Hello and welcome everybody. I'm Anthony Gonzalez and I'm the Senior Program Coordinator with the Higher Education Center. And I want to welcome you to our final session in our Spring Learning Collaborative. This session is titled Empowering the Future, Insight and Impact in Campus Health and Wellness. Our panel today is made up of Dr. Dolores Cimini, Joan Masters, and Dr. Allison Smith, and will be moderated by Logan Davis. Before we dive into today's content, I do just have a couple of housekeeping slides I'd like to share with you all. We do welcome your questions at any time throughout the live session. We just kindly ask that you utilize the Q&A feature so we can keep track of them. We do have the chat enabled, so please feel free to introduce yourself and share where you're joining us from, along with any reflections or resources as it relates to today's presented content. But again, we do kindly ask that you utilize the Q&A feature. We do have captioning enabled for today's session, and you should be able to turn it on through your bottom dashboard. Please feel free to send me a message if you have trouble getting that set up, and I will try my best to walk you through that process. We also encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different membership tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. Also, today's session has been approved for one advanced level contact hour for MCHES or CHES and MCHES. In order to receive the credit, you must attend the entire live session. There will be no CHES awarded for just watching the recording. You must attend the live session, as well as no partial credit will be awarded. You must complete the evaluation that should open up in a new tab at the end of this webinar. If you have issues accessing that evaluation, you should be able to locate it in the Scarlet Canvas course. And then you can expect to receive your CHES MCHES certificates within 30 days from the live event. We also have a few upcoming events that I would like to share with everybody. Our next water cooler chat will be taking place May 13th and will be focusing on becoming professionally developed. And our next webinar will be taking place the next day and is titled Preventing Collegiate Impaired Road Use, a Holistic and Student Inclusive Approach. We also have the 2025 national meeting taking place here in Columbus, Ohio in October 21st through the 23rd. We will also have a simultaneous virtual conference going on at the same time, and early bird registration is now open and will be running through July 18th. We also have our Training Advisory Committee application open. The Training Advisory Committee serves to inform our trainings for the year, including our webinars, learning collaboratives, and virtual symposium topics, as well as aid in the selection of topics and sessions for our national meeting. The applications to be a part of the Training Advisory Committee are open until June 6th. And with that, it is my great pleasure to introduce you today our panelists and moderator. Joining us today is Dr. Dolores Cimini, Director of the Center for Behavioral Health Promotion and Applied Research at the University at Albany. Logan Davis will be serving as our moderator, and Logan Davis is the Outreach and Engagement Manager here at the center. Our other panelist is Joan Masters, Project Director with Partners in Prevention. And our final panelist is Dr. Allison Smith, Senior Program Administrator with the Louisiana Board of Regents. Thank you all for joining us, and it's my pleasure turning it over to you at this time.
Thank you so much, Anthony. I really appreciate it and super excited to close out today's Most of the Day event with our learning collaborative, looking at the past, present, and future of our profession, looking at prevention and recovery in higher education and health and wellness. And so honored to be with this esteemed panel. I feel like I stick out like a sore thumb. These are three amazing people, three very strong women, obviously not a strong woman. Very jealous in that because strong women are awesome, but just some really, really amazing people and really excited to be with them. Before I ask them to tell you a little bit about themselves, I do want to introduce a little bit. And so you're like, why is this person the one asking the question? So as Anthony said, my name is Logan Davis with the Higher Ed Center. I oversee our membership model here at the center. And so I think for me, I was interested in engaging in this conversation because if we are going to provide resources and things for members in education, we need to think about it from a holistic lens. And so that looks like where we've been, how did we get there, where are we at, and where do we want to go? And so excited to get the opportunity and humbled to to lead and kind of guide this conversation and kind of ask the questions and then get out of the way a little bit. So super excited about that. So first off, my question. So I'm going to start with just basic introductions. Just tell us a little bit about yourself and your professional experiences in this field. But want to add to that, if you don't mind sharing as you go through your journey about a mentor that has inspired you and really helped you along your journey. So Dolores, if you're okay starting, just tell us a little bit about who you are, how you've gotten to this point, and a little bit about a mentor that has inspired you along the way.
Thank you so much, Logan, for inviting me to come and be a part of this panel. I'm very, very happy to be here. Hello, everyone. I'm Dolores Cimini, and in terms of my training, I trained as a licensed psychologist, and I'm actually a licensed psychologist in New York State. And when I trained several decades ago, I thought when I got my PhD that I would be exclusively engaged in private practice, seeing clients every hour, every day of the week. But after graduate school, I was hired to work at our University Counseling Center at the University of Albany. And my mentor, and her name is Dr. Estella Rivero, saw something in me that would be a good fit for doing prevention. Now, I had no clue about prevention. I knew about clinical services and how to deliver those. So I had a lot of learning to do. And I got the opportunity to be the director of a program called Middle Earth, which had a hotline service at the time and now has expanded to do other things. And then after that, I learned a lot more about alcohol and drug prevention and was fortunate enough to get some grants during a time when grants were plentiful for colleges and universities, and built a comprehensive program based on a public health framework over the past few decades. And then the grants consumed so much of my attention that I felt I couldn't do as much of the practical work involved in prevention. So I had the opportunity 3 years ago to move full-time into a faculty position at the university. So I'm engaged in less doing on a day-to-day basis, but I'm actually now involved in training the future through teaching and through research, through some grants, and I'm very delighted to be in this position. And as I move toward the end of my career in a few years.
Awesome. Thank you so much, Dolores. Delighted to have you with us and to learn from you over the next few minutes. Joan, are you okay going next?
Mm-hmm. Hi, everyone. I'm Joan Masters. I'm the Senior Project Coordinator of an organization called Missouri Partners in Prevention, which is the statewide coalition of many of the colleges and universities in the state of Missouri. We are based at the University of Missouri in Columbia. That is where our project lives. And I have had this sole job for the entirety of my prevention career after graduate school. So I find that, I think, a bit unique in the field. I had a fantastic mentor at the University of Missouri as I was a peer educator and a student leader named Kim Dude, who is the director of our Wellness Resource Center at the University of Missouri. And as a college peer educator, as a sophomore, she luckily saw, like Dolores said, something in me that said prevention and prevention leader. And so as an undergraduate and graduate student, I had the opportunity to be a student trustee for the Bacchus Peer Education Network, and also serve as a student on the NIAAA Call to Action panel that was brought together to address college drinking in like 1999, 2000, which really, I think, set me up to want to do this work full time and not just as a peer educator. I've been trained as a teacher for at-risk youth. And so I think something was always calling me to help others and to support others And so I went to graduate school and got a degree in counseling psychology and college student development with no intention, unlike Dolores, to be a therapist, but it was incredibly helpful background for me to be able to work with individual groups and understand group dynamics and like how to create partnerships with people. And so in 2001, I became the coordinator of Missouri Partners in Prevention, and our organization has grown to be from being a single issue statewide coalition addressing binge drinking to addressing all issues of college student health and well-being and their intersectional relationship with each other, and to support over 30 colleges in the state of Missouri in some way with all of the programs that we have. So my mentor was really key early in my career at reminding me sort of that I wanted to learn more and more about serving others and training others to do prevention and not just doing prevention directly in my job, that I wanted to be a support and a trainer. And so she encouraged me to be involved in as many national organizations and conferences as possible. And that's really where I met a lot of these wonderful people that are on the panel today, but also people that have continued to influence me in my career.
Absolutely. Thank you, Joan. And sorry, Allison, I'm going to go to you. And Joan, that's actually something I've never heard you say about someone in kind of pointing you in that direction of serving and preparing others to do the work. And I think that rings true for you. And so thank you for that. And I think for being that resource for others. So Allison, we'll round out this question with you.
Hey everyone, my name is Dr. Allison Smith. Sorry if I come with a little bit of background music. I'm in a hotel. But my journey started I did my undergraduate at Southern University, where I later learned that I was a peer health educator and I didn't know it. I thought I was just gathering my peers together for pizza in a random room in Blank's Hall room 128 to talk about sexual health, all of these things, HIV prevention. But I later found out that was really doing peer health educator work. That's kind of how I stumbled into all of this. But when I went to LSU to work on my master's, part of my master's entailed doing a internship, and I just randomly applied, and I ended up at SAMHSA at CSAP. Very random story. But Rich Lucy is one of the first people that I met. It was like, oh, this is a field of what happens. And we also work with college students. That was the first time I'd ever considered this kind of field with college students. Once I get back start my internship, the person who hired me had gone on maternity leave. We did a phone interview that summer. She never came back from maternity leave. So I was a very busy graduate assistant. And at the time, my boss, Dr. Catrice Albert, who was phenomenal, she left us to go to the University of Minnesota system, and then went on to the NAACP, the NCAA, and now she's at the University of Kentucky. But some of those steps, she pushed me. She's like, well, you can do this. I was like, well, this is a lot for a graduate student. She's like, that still doesn't mean you can't do it. It's just something you've never done before. So she was really instrumental and like pushed me like, you can do this. And I've had that happen multiple times. So I'm going to kind of take the course of talking through multiple mentors. Eileen McRae, if you've ever worked in collegiate recovery, she's a phenomenal force, particularly in the Southeast. Eileen was like, well, if you want to start collegiate recovery, you can do this. And it was hearing the same phrase, you can do this, even though it's something I had never done. She really helped. One of the biggest, I call her my recovery fairy godmother, that helped like kind of push me into getting into the recovery side of the work we do here in Louisiana. And then our current Commissioner of Higher Education, Dr. Kim Honoree, is phenomenal. So like Joan, we initially started out as a single substance issue. Our coalition, the Louisiana Higher Education Coalition, started in 1998 after the 1997 binge drinking and hazing-related death of Benjamin Wynn, and it was solely focused on reducing binge drinking rates around alcohol. But now, even like through the pushing of our commissioner now, we also work on Title IX and power-based violence, mental health, collegiate recovery, and also hazing prevention. So working on all of these things, like Joan mentioned, it's a thing where now we're to a point where I don't think we have the luxury of focusing on a single issue when it comes to college student health and wellness, that we all like. I really wish we all got paid a lot to do one very specific job, but that's not the place where many of us find ourselves in. But it's been a really incredible ride meeting all the folks on this call and so many other amazing people and speakers you've heard today. Like on the last panel, Sarah Neray was like one of the first people I ever heard talk about collegiate recovery. And it's amazing to see where her and Ahmed are in this journey years later. But that's kind of how I ended up here. And so we are at our Board of Regents, which coordinates all public higher education in the state of Louisiana. So we're a coalition, but we're housed at our governing board. We're funded by our Department of Health.
Awesome. Thank you so much, Allison. And I'm going to come right back to you on this question. All of you mentioned and highlighted your individual interactions with mentors. And I want to think a little more globally is, as we're talking about empowering the future, the title of this panel, why is mentorship so important in our profession? And then so feel free to reflect on your individual experience, but globally, why is the concept of mentorship so important?
One, I don't think we have the luxury to waste time and watch people needlessly stumble when we have the answers to help them. We all, like, if I had just known this one particular thing or this one little tweak, I could have done this to get a lot further, a lot faster, to serve a lot more students a lot quicker with a lot less resources. I don't think we have the luxury of hoarding that information, especially with the time that we're in now. One, as we're seeing increased mental health issues on our campuses, more and more emerging collegiate recovery programs, and we're still seeing very consistent rates on alcohol use on our campus. That still has not gone away. So one, we don't have the luxury of waiting for people to figure it out on their own. And also, it's a really just kind thing to do. And we could all use a little bit more kindness.
Absolutely. Absolutely. Joan, do you want to go next? And Dolores, do you want to wrap it up after Joan?
Sure. So I think that I'm now in my career where I have folks that I mentor, and I still have a mentor or mentors that I look to, and it's kind of a unique, I guess, place to be sandwiched in the middle of that. And I feel like this work is just really hard. I mean, I've been doing some training with some colleagues in the state of Virginia the last couple of days, and we've been talking about how, this prevention work doesn't win you favor with lots of people on campus. You're not the most popular person by bringing up things that make people uncomfortable or policy changes that are needed, or, it's kind of a squeaky wheel. It's a problem that enrolls every semester and doesn't graduate. And so we need people to champion us or to remind us of the bigger picture. We need mentors in our life to remind us of what our goals are and to help keep us on track, but also to remind us that we're bigger than any challenge that we're experiencing in our work. I think one of the things that pains me the most in our statewide coalition, or even amongst my staff, is people that feel burnt out by the work and don't have anyone that is there reminding them about the greater picture of the work, or to take care of themselves during that burnout, and to remind them that they're a human being before they're anything in this work in public health. Especially now, it's certainly been difficult, I think, for those who don't have mentors, to not have a sounding board. And so I think I'll echo Allison's comment. Like, it's the kind thing to do. It's the way, especially as women in this field, even though most of us working in this field are women, I still feel like we need to be reminded or have someone in our court that isn't just our supervisor or isn't just our staff, that our work, is important and needs to be championed, and that, taking care of ourselves is important as well. Dolores, I'll send it over to you.
Thank you. And following what you're saying, Joan, and you as well, Allison, the support that a mentor can provide is critical, especially during these times. Students are coming to college campuses with much more complex alcohol and other drug issues, histories of sexual assault and sexual violence, mental health concerns, and it's a very, very complex environment. At the same time, because of societal issues going on today, colleges and universities are struggling financially, struggling with enrollments, and sadly, one of the first things that gets challenged is the dedicated positions to address alcohol and other drug misuse prevention, for example, and the specialized positions. There is currently a focus on health and well-being in a general sense, but it's really, really critical for the specific mentoring in the area of alcohol and other drug misuse prevention to continue to take place. At our own campus, for example, we are collecting data on both well-being and also alcohol and other drug use prevention. And what we're finding is some very unusual results in our data. That is, the more students report flourishing, the more they report higher well-being, the more they're consuming alcohol. And now that's a very interesting finding, but it also supports the need for mentoring of the newer generation of prevention professionals to try and understand this issue and also to continue to have a seat at the table. And so what mentors can do is they can help with the self-advocacy, help with the support, and help with the persistence that's needed in the face of these new challenges in our higher education institutions.
Dolores, before I ask a follow-up question that came in from the audience, I do, if you don't mind sharing, I think I've heard you mention before about the importance of mentors from historical context, about being able to provide a little bit about the history and, keeping, there's some sustainability in our field. Do you mind touching on that for a second?
Of course, yes, absolutely. So some of us have been around for decades. We've made a lot of, I will speak for myself. I have made a lot of mistakes. I often have found myself building the plane while flying it. And so I've learned a lot, and as a mentor, I'm happy to share the knowledge, the experience that I've had, and also the failures that I've had. I've had many. And so it's really, really important, though certainly there's new research going on, there are new strategies that are on the horizon. It's important as well not to forget the history, not to be in a position to reinvent the wheel. There is a lot of opportunity to move forward, and history is very important. Certainly, as newer professionals coming in the field, you can decide whether to take the information we provide in terms of history, reframe it, abandon it, but it's important to hear about it first so that things can move forward, perhaps in a seamless way, and that basically you would be less likely to make some of the mistakes that I've made, and to not experience some of the failures that I've had. So, and I put that out there.
Absolutely. Thanks so much for sharing that piece. The humanity piece, I think, that Joan highlighted, and then the vulnerability piece, so important. We had a great question come in the audience that fits right here. Is finding a mentor or connecting with some can seem daunting. And so what advice would you all give to those that are looking for mentors? How does it work? How do you get and find them? Like, how do you start that relationship? It can seem awkward just going up to somebody and being like, Allison, will you be my mentor? Right. So we know it's going to take a lot of gusto to do that. So what does that look like, Allison? How does someone reach out and find a mentor?
So for me, I think the one thing that has been the most successful for me in gaining mentors is follow up and follow through. Because lots of times you'll see people in the field, no matter what field you're in or no matter what the topic, people will go up to them after a conference and say, oh, would you mentor me? Or I'd like to have a conversation with you, or can I get your card? And most people never follow up with them. I am relentless at following up with people that I tell that to, because what always happens, they'll be like, you know what? I gave my cards to like 9 people. You're the only one that followed up. And before I ask them to mentor me, what I'll ask them is just like, can we have a quick 15-minute conversation or so, kind of see about your journey? And then for me, I always go into that conversation with very specific questions, because everybody's done the tell me about your story kind of thing. But what are the things, or what do you admire about that person's journey or what skill or competency do they have that you like? If I want to learn more about the strategic prevention framework and I'm looking to find a mentor about that, if I approach Joan, I'm like, Joan, what are the 3 key things I need to know most about the strategic prevention framework? That's more likely to spark a more meaningful conversation. And so tell me about what you do in Missouri. That's a whole lot more likely to generate more conversation. And it's through the more in-depth questions when you follow up that you can kind of figure out if that person's a good fit for you for a mentor. Because sometimes the fit isn't right either. And so following up and following through, asking specific questions, and then checking to see if the fit is right.
Joan, I'm seeing lots of head nods here. Do you care? Do you mind going next?
I will always head nod, Dr. Allison. Like everything both of these women say, I'm just like, I'm right there with you. I think there's a couple of different ways too, is letting people know that you're open to mentorship. Like I've had a few folks that I let them know that if they have any young employees and they need a mentor outside of being supervised, I'm happy to help, and vice versa for my own employees or team members. So just kind of letting people know that you're open and you're willing to help. I think Allison is right, like 100%. It is the follow-up, it's the specific questions, it's getting to know people, it's developing that win-win with someone. Prevention is 100% relationship building. If you don't know how to build relationships with others and be able to see commonalities among others, whether you're coalition building, relationship building for mentorship, etc. And you're just like sending an email saying, I need a mentor, will you do it? That is not as same as, hey, do you mind if we, grab a virtual coffee and, I'd love to hear about your career because I'm kind of determining my next steps for my career. That's a specific ask to develop fit. You don't even have to say the word mentor to someone. For those of us who have been in the field for a while, we've had short-term, like, a couple of Zoom meetings with a person or been on a committee with, Dolores and I were on the National Meeting Planning Committee together a long time ago, and she just had so much knowledge to share that I considered her relationship on that planning committee together to be mentorship to me, because I was watching the way in which she was responding or giving feedback, and that gave me information. So mentorship doesn't also have to be like this formal relationship where you have, a standing meeting at 2:00 the second Tuesday of every month. I do have that with one of the students or the young people that I mentor, young professionals, but it also could just be someone that pops in and asks questions or asks for support when they need it.
Absolutely, Joan. It makes me think that mentors, they need to have matching friendship bracelets. I think that's definitely going to be a requirement. Dolores, as I ask you to kind of wrap up this question, as you finish that, I want you to think about the flip side as well, is how can people become mentors, right?
Sure.
Like, how do we push ourselves out of the comfort zone to think about what does it look like to become a mentor?
Sure, and I totally agree with what Allison and Joan have mentioned in terms of how to start a mentor relationship. And I'd like to focus a little bit on how do you find a mentor in the first place? How do you actually find a person that may have common interests as you do, somebody that you want to connect with? And there are a number of ways to do that. Certainly, going to webinars, and many are free, especially the HEC AOD webinars. Going to the webinars that HEC AOD has every month, the water cooler chats, going to virtual conferences and in-person conferences, and really, if you go to a program at any conference or webinar, and something interests you, don't be afraid to follow up in the ways that Joan and Allison have mentioned. I know that I'm very open to talking to people when I go to conferences. It's easy to spot me. I'm visually impaired, and I travel with a lovely yellow seeing eye dog that wants to be friends with everyone I'm around. So you can spot me easily there. And I'm happy to talk with people and engage in ongoing relationships as a mentor for anyone that has common interests as I do. So those are some ways to do that. And then in terms of being a mentor, we are in very much need of mentors. There are a lot of colleagues on this webinar and colleagues nationally that are doing great work, and I know would be very interested in supporting and helping to train and mentor the new generation of preventionists and interventionists. And for potential new mentors, don't be hesitant to reach out and lend a hand to a new professional. Don't be hesitant to reach out to lend support to new professionals. And, you know, one of the questions that potential new mentors may have is, I don't know, how can I be a mentor? I feel like I'm learning every day. And that's okay. I'm still learning. I've been in the field at this point almost 40 years, and I learn new things every single day. But I do also have things to share, and many of you out in the audience, I'm sure, can experience the same thing. You have lots of experience, very, very important perspectives to share with newer professionals. So please feel free, if you see someone that might be interested in something that you are focusing on, to reach out to them.
Absolutely. Thank you, Dolores. Allison or Joan, anything to add there about encouraging people to be open to being a mentor?
Yes, one thing I just want to say that I think is really important that is tangential to mentorship, and that is being a good supervisor and champion of the younger staff or the newer staff that work with you. I think we miss that in prevention a lot, because prevention can most definitely be a single person doing the coordination of the work, and then their supervisor or team lead is not in prevention. Maybe they're in counseling, maybe they're in student affairs or somewhere else on campus. I can't tell you the number of staff I've had come back after, you know, like being on our team and going somewhere else, or, you know, hearing really, truly horror stories of supervision from folks of not, you know, championing the new prevention workforce. And I think that's why we're having this conversation about mentorship, but also you can use mentorship strategies in your supervision. I truly believe that our mentors should not be our supervisors, but I also believe that I have a role for my employees and my staff, who are the future of prevention, who hopefully will be working in the field after I am not, to leave that legacy and make them understand the important role that they have. So I think that it's not only requesting or looking for mentors, it's also looking for positions where you're going to be treated as an emerging professional or as a professional that's valued in the work, because that's going to be probably some of the most fulfilling experiences. And I think for those of us who are supervisors, we have a great responsibility to take that seriously.
Right. One of the things I'll add is that I think there's like you mentioned, a duality that you're being mentored, but you also can mentee. I would offer, having been doing in this field this is my 15th year, which is weird, seems weird to say now, but if you've been in this field at least 3 years, there's something you can tell somebody in year 1. There are things that you can share. You may not know, you may not have as much information as Dolores has, who's been doing this for 40 years, but there's something you can tell a new professional who is timidly stepping into their first month on the job, something that made the first couple of years of your journey a lot easier. And one other thing I'll raise about specifically being a mentee is being coachable and self-aware. Because if you're in a place, it's very hard to mentor someone if they believe that they have all the answers to all of the things all of the time. And one, being open to new ideas or new ways of doing something, or just being open to, you may say, why, I have this very clear answer to this very complex problem that has existed forever. And maybe there may be a reason why no one's implemented that particular answer. So being open to understanding that there are other factors or information that you may not yet be fully aware of, and just being open to receiving some of that information in a safe and like an encouraging, accountable space.
Absolutely. I feel like we could talk about mentorship for the entirety of this webinar, but unfortunately, we have to move on. But I want to stay on your experiences for just a bit before we kind of move in to the future, but want to look at and think about impact. And then so thinking about how we got here, and so specifically thinking about the question, what is something in your career that has made and continues to make impact? And Dolores, I want to start with you here because you mentioned the peer recovery program. Um, it, that has had a lasting impact on that. So Dolores, I want to start with you, and then Allison, if you don't mind going next, and then Joan wrapping us up. But talking about what's something in your career that has had a continued impact. So Dolores, do you mind kicking us off?
Well, certainly I would hope that my experiences over the years have made an impact in some areas. I believe that my areas of impact were in advancing peer education in its various forms, because there are many ways to deliver peer education. I know within the Middle Earth program, we have trained in my tenure over 2,000 students, and it makes me so proud to see what they're doing in their careers, how they're advancing and creating their own legacies. So that I think the impact and the degree of impact that I make on others is really gauged by how proud I am of all my former students and mentees. I'm also proud of the impact that my work has done in the development of evidence-based practices, particularly with regard to screening, brief intervention, and referral to treatment. We've designed programs and strategies for a variety of populations, fraternities and sororities, first-year students coming in for health and counseling care on campus, international students, a variety of different populations. And then also how I've helped to move forward on my own campus and on other campuses as well, taking a comprehensive public health informed approach. I was trained, as I mentioned, as a clinician. So I thought I would just be helping people one person at a time. And that's really very important. But we also need to move upstream. And with the skills that we have as prevention professionals, we can move forward and help potentially thousands, whole populations of college students. And so that's what I want to leave in terms of my legacy and my impact on others.
Right. One, it's always hard to follow Dolores, right? But two, I think for me, the most impactful thing I've done in the state of Louisiana is help bring collegiate recovery programs to Louisiana. Because if you look at the state of Louisiana now, we currently have 9 programs, 6 of them that started with an expansion grant in 2022. Well, the first one started in 2019 with Southeastern Louisiana University, their lineup recovery program. In 2022, they received a grant for some funding for them, and also to help 5 other programs. But then also we just announced a new round of funding for 3 new programs that will go through 2027. But even though it looks like a lot of that work popped up overnight, that started in 2013. From us getting a Transforming Youth Recovery grant in 2014, all of this groundwork that had been done, even when times it looked like the work had disappeared or was going away, one, finding ways, like Joan said, to continue building relationships with people, educating new stakeholders. You get really, really good, you get really close, and then the person leaves and go become the president of the University of Alabama, right? I told you I was at LSU. or finding new stakeholders, new administrations, that's both federally and both statewide for your state. Different governors have different priorities sometimes. One, making sure that the prevention and recovery efforts on our campuses are treated with the same urgency as we do for the broader community, and also integrating our higher education population. When Louisiana Department of Health talks about their community substance use strategies or harm reductions for opioid use and all that, that includes our community colleges. So we're expanding collegiate recovery programs. We have Narcan that's available for free on all of our campuses. So finding those ways to bring harm reduction methods and raise the level of prevention on our college campuses has been something that in my wildest dream, I would have never saw me doing, but it is the most beautiful accident I've ever fallen into.
Allison, I want to follow up. Sorry, Joan, to cut you off here. I thought about this when you were talking about one of your mentors in graduate school. Is just because you've never done it doesn't mean it can't be done. And now look at the impact that collegiate recovery is having in the state of Louisiana. And then so I think it just highlights the impact of mentors. Because if you hadn't learned that in grad school, maybe we're not talking about this impact.
Absolutely, because one is like, okay, this is the new set of circumstances. How do you move within these new bounds to get what you want to get done? And I think that goes to a broader context. We're all going to run into roadblocks, challenges. Things are not, we all have really great strategic plans. And if you ever talk to Joan or Dolores or Rich Lucy, you know about the spiff, that it's a really good strategic plan. But what happens when it falls to pieces? Are there external factors that blow that up? How do you rebound from that? One, you may have to do the thing that you've been desiring to do a different way and not giving up on that fact. Just because the path changed, that doesn't mean the goal changed.
I'll say, for me, in terms of impact, this is a really hard question to answer. For me, I'm not sure why. In Missouri, we've had a lot of fantastic measurable change, and that feels like just part of my job. I had the very unique experience this year of my son as a college student going to one of the campuses that is in our statewide coalition, and me receiving my own resources back as a parent in my parent orientation about alcohol and other drugs. And so that was kind of like a full circle moment that I always felt like I was designing or creating things for our coalition, like all of the college students in Missouri were my children, or that I would want to receive if I was sending my son to college. When I started this work, my son was not even a thought. And so to know that, like, 24 years later, I would be receiving my own resources as a parent. But I honestly, truly believe that a couple of things, that our impact actually is very difficult to measure, because when we do our jobs right, bombs don't blow up. We don't have major incidents on campus. And, it's prevention that provides the resilience against those terrible events that could be occurring on our campuses that are impacting our students' lives. And so, to me, I think why the biggest impact I feel like I've made is in the prevention workforce. And again, reminding people that they can continue to do this work. Having mentored former staff members of mine that weren't sure that they could manage a career or working to build something like Missouri Partners in Prevention while also having a family. And, and I've had former staff come back and say, like, it was because of my conversations with you, or feeling like I could have, I could be a well-rounded person and still give back to my community. That feels like, honestly, the biggest impact, those statements to me. But I think that because we have continued to see measurable change in Missouri in terms of binge drinking, impaired driving, cannabis use, et cetera, there's that impact. But also we haven't seen, again, large scale problematic behavior because of the prevention that's been in place. And truly, that is the role. We think everything in prevention looks inefficient until we suddenly need it. And then we realize how important it was to kind of hold in place some of those major tragedies that could have occurred. So.
Absolutely. Just tremendous work. I mean, I'm at the moment just in on and know that that is just a snippet of what you all are sharing of the great work that you have been done. And if I seem distracted, I apologize. Today is the day that the 13-year-old Maltese Shih Tzu decides that he wants to sit in my lap during work. He never has done this in the last like 3 years we've lived in this house. But of course, today is the day. And makes me think of the skills that it requires to hold a dog and moderate a panel. Was thinking about how you all were highlighting some of that work. There's some skills in there that you've harnessed, or when thinking about what does it look like to move recovery throughout the state of Louisiana. And want to highlight some work that Dr. David Anderson has done. So we led a work group that developed a guide for 8 core competencies for higher education substance misuse prevention. Anthony is going to put a link to that guide in the chat. Really, really good stuff. But I want to use that as a guide for our question. So thinking about it, people know it's available. So my question for you all is, why is thinking about or identifying necessary skills in this work important? Why is it important for us to think about the skills we need to have and need to continue to develop? Dolores, are you okay starting with this question?
Yes, absolutely. So in any profession and any type of work we do as, in this case, prevention professionals, we need a guide. We need to know what we're working toward, what we need to focus on in terms of skills, and those are competencies. As a psychologist, I've served on a national committee related to accreditation, and in that profession there are 9 competencies, and those provide a framework in terms of how we're trained, how we do our work, and what we focus on to be competent prevention professionals. And I've looked at the competencies a number of times. It's great work that David and your committee have engaged in. And I would say I really can't pick one competency that we should focus on, because they're all interrelated. They're all connected. And in order for us to be well-rounded professional prevention professionals, we need to engage in learning and skill building across all of those areas, to know what theories there are out there, how do we implement good prevention, what are some of the essential skills that we would need in terms of implementation of interventions, advocating, and the like. So I see them as a bigger package, and I would say it's important to focus on all of them.
Joan, are you okay going next, and Allison wrapping us up here?
Sure. So I had the honor of working with David a little bit on the committee that looked at the competencies and finalized them. And then at the same time, I was also working with another organization to create a training for new professionals into higher ed or into higher education substance use prevention. And we've continued to do that training with a couple of states in 2025. And it's been really exciting as I have taught others to teach the course. And what I am hearing overwhelmingly about the competencies, but then also about just like the fundamental knowledge that we need to move forward is learning about the strategic prevention framework and the idea of being strategic in higher education substance use prevention. I mean, you've heard it from both of my colleagues here, that we have to think about the reason why we're doing something, whether or not we have the capacity to address a particular issue, and then plan with intention and select evidence-based practices with both, the changeability in our communities, but also whether or not we have, again, the resources to do those things or select those evidence-based strategies. So, and we the competencies remind us of the importance of being strategic. In terms of I do have a favorite competency. I agree with Dolores 100%. They are all important and it's difficult, like children, to pick just one that's your favorite. But I particularly think that the competencies are not the competencies without policy and environmental strategies, because we can know everything we need to know about prevention, but if we're not setting the ecosystem on campus up for students being successful, or making positive choices or making healthier choices when we're doing the education or doing the outreach with students or providing the support or building the recovery community. If we have a recovery community on a campus that also has a terrible kind of ecosystem that does not support students who are in recovery. We might have a group on campus, but then as soon as you walk out of the student center, there is bar restaurant promotions or, like very lax alcohol regulations or policies on campus. That's really problematic. And so I think the importance of reminding us that we have to change the environment on our campuses so that the programs that we do for individuals and the individual interventions have the stick-to-itiveness on our campuses that last longer than just the intervention that we're doing. So if you haven't taken a look at Dr. Anderson's work, I think it's really valuable if you supervise someone who's new to the field, or if you are in the field and kind of wondering, why do I feel like I, don't quite know everything, or I'm falling down a little bit. The competencies, I think, give us a good North Star for our work.
And Allison, as you get into your answer here, do you mind sharing about the work that Rich did at Campus Drug Prevention, about the link that you shared? I put it in the main chat as well.
So yes, on the campusdrugprevention.gov website, which Logan just dropped a link into, there are all 8 episodes. You can watch all of the resources, you can watch all the videos, get all of the links to the competencies available for free on the campusdrugprevention.gov website. And I kind of have like a 2-ish favorite, and I kind of like to combine 2. One, the policy and environmental strategies, and then the other one, communication and advocacy, because I think I like them all, but I think in this season that those 2 are going to be really critical. Potentially, what is good policy and how do we implement policy, whether we like policy or not? How do we implement it in a way that preserves us and serves our students at the same time? Because both of those can happen. And I think communication and advocacy, and drop a 1 in the chat if you're at a public institution, because I think most of us are at public institutions where it's not necessarily where you're at a private, so there's a different level of protection. So what I thought, it was lots of 1s in this. So with that, and I say communication and advocacy, those are usually 2 things we don't find ourselves doing in prevention. If you're on a campus, there's usually a communications department that handles like most of the external thing, besides maybe a social media like an Instagram that you have access to. Or then the advocacy piece, we're like strictly forbidden from advocacy, but there are ways to advocate. There are ways that you could advocate internally on your campus. That may be sharing national resources or press releases with your internal campus stakeholders. So for instance, there was some funding cuts that recently happened, and there were several states where collegiate recovery programs lost their funding. I think the executive director for ARHE, the Association of Recovery in Higher Ed, Christina Canfield, did an excellent video talking about during Collegiate Recovery Week last week, talking about the importance and the value of collegiate recovery, why we shouldn't be invested in it, how it impacts student success or intention. And if you're having a hard time talking about collegiate recovery on your campus, just sharing those kind of videos, those kind of resources where you're not having to advocate. For instance, for us, we celebrated Collegiate Recovery Day. We have our programs. We sent like little video snippets to those that submitted videos, or we sent a note to our legislators, key legislators who have a collegiate recovery program in their district. Hey, this is what's going on in your district. This is the amazing work taking place in your district. One, just sharing with them, not necessarily advocating, but making people aware. And I think there's a fine line between awareness and advocacy that prevention is going to have to be a lot more vocal about, because once you're pushed in the broom closet, it's a little bit harder to advocate. But if you go kicking and screaming, sometimes it makes them stop. So part of those things is just making sure that we use our voice and to tell the story of prevention, to tell the story of collegiate recovery programming on our campus and why that matters. Because I can tell you, I'll share with you how important it is. if any of our campuses, none of our campuses are immune from ending up on the front page of the paper tomorrow for a student tragedy. Everybody gets really, really interested in prevention once that happens. Treatment and recovery, all of these things at the forefront. But part of that, until they come around to understanding that we should be a first stop and not a last resort, start finding ways to ingratiate your work into the broader work of the campus. So for us at the Board of Regents level, when I talk about like the prevention and recovery programming we do, it's not just a personal passion project that I like. One, it's life-saving for students, but two, it also is a student success and retention strategy that helps us reach our master plan attainment goal of 60% of all working age adults receiving a high value credential by 2030. That's a whole lot different than saying we have this really great feel-good program. So learning to talk about it in terms that mean things to other people. We get very comfortable in communicating on what's comfortable to us and not necessarily how the receiver needs to hear that. So being sure to communicate, you may have to communicate the same information in a billion ways, but for every stakeholder that you want to engage, making sure that you communicate in a way that resonates with them.
Absolutely. Thank you, Allison. And unfortunately, we are coming to the end of time. This conversation has been fantastic, and I'll say thank you for the first time, and we'll do it many, many more. But as we wrap up, I want to ask you to think about one piece of advice that you would share, but I want you to think about it in terms of the conversation that we've just been having over the last, I think, 30 minutes of around impact. And then so thinking about impact, why it's important, why we need to think about it in the current times that we're in. So what's one piece of advice, thinking in and around impact, that you would share as we wrap up? And if you could do that in a minute or less, Anthony would be very, very thankful for you. Joan, are you okay starting? We'll go Joan, Dolores, and then Allison.
Sure. I think build relationships is always going to be and use data as the currency of your work. If you don't have data in what you're doing, if you're not sharing with others about your impact, you're missing the opportunity. One of the best kind of pieces of advice I've received recently from a mentor was that we need to begin to tell the stories again of the bombs that don't go off, of the tragedies that are prevented, and really tell the story of prevention using things, even calling it an impact report, or it's not just the amount of events we held or meetings we held or relationships we built, but what are things that have happened because of our work. So building relationships, championing those, and then telling the success stories, I think is really important.
Okay, I will go next. And what I would say in terms of advice is that it's important to persist. It's important to keep on going no matter what the challenge is. Sometimes, as we heard today, prevention professionals are not welcome. What they have to say is not necessarily welcome all the time, but we need to be there. We need to be at the table. We need to be part of the discussions. And related to that, please do consider connecting with mentors who can give you the support to persist, because it's critical, especially during these times of societal upheaval.
All right, and before I wrap us up, there was a question in the chat about how do you help other staff members on campus who don't necessarily feel comfortable talking about students with substance use? If they're not in a place where they're comfortable, help develop some handoff language that can help them get the students to the people who should be handling them, where they are not stigmatizing and they do not cause harm. So even if they don't know what to do, they need to know who to get the student to. That's that piece. And then the other piece I would say is make sure that you're talking about your work in as many ways as possible. Incorporate your work into the broader sense, like broader departments, broader units, student affairs, your entire unit, but then also making sure that you have a tight elevator speech. Should you run into a campus administrator, that you can quickly explain what you do, how it's impactful and why it's important.
Awesome. Thank you so much, Allison, Dolores, and Joan. What honor to be with you this afternoon. Thank you so much for sharing of yourselves and of your experiences. I know I appreciate it, and our audience has as well. And at this time, I'm going to hand it over to Anthony and Cindy. Go to both of you.
Thank you. Thank you, Logan, and thank you to our panelists for sharing of themselves and their expertise. I'm going to hand it over to Cindy, our managing director, for some closing remarks.
Hi, everyone. I'm Cindy Clowner, Managing Director of the Center, and I just want to thank Dolores, Allison, and Joan for such an insightful and inspiring discussion, as well as to Logan for moderating it. And as we bring this special learning collaborative to a close, I also want to thank each of you for being a part of it. Today's sessions were more than just a reflection on our field's past, but they were a launch pad for the next decade of innovation, collaboration, and impact in collegiate alcohol and other drug prevention and recovery. We've heard from leaders and change makers who've shaped this field from the ground up, who have learned about the evolution. We've learned about the evolution of alcohol harm reduction and recovery efforts, and we've gained tangible strategies to take back to our campuses and communities. From historical insights to future-facing discussions, this day has really captured the essence of our theme. And so as we celebrate the Higher Education Center's 10-year anniversary, we're reminded that this work doesn't happen in isolation. It happens because of all of you, your dedication, your passion, and your unwavering commitment to student well-being. And so I want to challenge you to continue the conversations, to build on the insights we've learned today, and to stay connected to our community of professionals, shaping what the next 10 years will look like. So thank you again, all of you, for joining us. And here's to the future of collegiate prevention and recovery. Thank you all.
Thank you again, everybody, for joining us. Just as a friendly reminder that the session has been recorded, and you can expect to see the session recording as well as the evaluations and any materials that have been shared in the Scarlet Canvas course. I've just dropped the Scarlet Canvas course link in the chat. But again, the session has been recorded, and you can expect to see it added to the Scarlet course within 5 business days. Thank you again, everybody, for joining us today for the Spring Learning Collaborative. And Logan, you have
Allison, do you have a final thought to wrap us up? Oh, never mind. Okay, we're good. Sorry, Anthony. Thank you, everyone. Take care.
Take care all.